Professor Dr. Tarek Ali. Hello to all my friends and my colleagues and my fans and my students everywhere. This presentation is to healthcare professionals, to doctors, physicians and surgeons. Because this is a clinical topic or a medical topic or a clinical reminder as a continuation of my clinical lecture series in my YouTube TV channel. Today I will talk about what we call viral hemorrhagic fevers. Viral hemorrhagic fevers. Viral hemorrhagic fevers is a group of severe illnesses. Characterized by حاجتين مهمين, fever وبleeding. Characterized by fever, two important clinical features. Fever and bleeding. That's why they are called viral hemorrhagic fevers. From its name is clear that there is hemorrhage and there is fever. So this is a group of severe illnesses caused by several viruses. So as it is clear from its name, it is caused by viruses and it is characterized by fever and by hemorrhage or bleeding. The viral hemorrhagic fevers are caused by several viruses, but the most common are the following. Number one, the Ebola fever, which was discovered around Ebola Lake in Central Africa. That's why it's called Ebola fever, because when it is described around the Ebola Lake in Africa. And the cases discovered for the first time were in this region. That's why it's called Ebola fever. It's an African viral hemorrhagic disease. Lassa fever also in Africa. And Marburg fever or Marburg disease, as described by Dr. Marburg, also in Africa. So these three fevers, they are common in tropical Africa. And most of the viral hemorrhagic fevers are described and common in Africa, in tropical and subtropical regions or countries in Africa. That's why, rather than in temperate climate countries or regions. That's why they are common in Africa. Again, Ebola fever, Lassa fever, and Marburg disease. Ebola fever, this is one. Number two, viral hemorrhagic fever is Lassa fever, Lassa fever, and Marburg, Marburg, as described by Dr. or Professor Marburg, who described the first cases of this fever while he was working in Africa. So called Marburg disease. So Ebola fever, Lassa fever, and Marburg disease are three common viral hemorrhagic fevers. In addition to the well-known other famous viral hemorrhagic fevers, which are the yellow fever and the dengue fever. اللي هي الحمى الصفراء وحمى الدنج. So we have also dengue fever, which is commonly called the breakbone disease or the breakbone fever. حمى تكسير العظام. dengue fever اللي هي حمى الدنج أو مشهورة ب breakbone fever because it's characterized by severe body pains and severe bony aches, as if the bones are broken, but there is no fracture. It is just a description due to the severe body pains and the aches and the myalgias and the arthralgias and the severe headache and the severe bony pains in those cases. So we call it the breakbone disease, which is another name for the dengue fever. And also the yellow fever and the Crimean Congo. Another fever is the Crimean Congo hemorrhagic fever. In addition to other less common viral hemorrhagic diseases due to hantavirus and due to Sudan virus and due to what we call OMSK virus or OMSK hemorrhagic disease or OMSK hemorrhagic fever. These are less common. Again, the hantavirus fever, the Sudan fever or Sudan virus fever, and the OMSK hemorrhagic fever. These are less common than the first 6 which I mentioned. اللي هم again Ebola fever more common, Lassa fever more common, the Marburg disease more common, and the dengue fever, and the yellow fever, and the Crimean Congo hemorrhagic fever. All of these fevers are more common in the tropical and subtropical regions or countries, especially in Africa, as basically or first described. And they are characterized by fever and bleeding. And they are severe illnesses. Many of them, they might recover, but in more severe cases, they might be, when they get what we call the severe, or they enter into, or they pass into the severe phase, they might be life-threatening and fatal due to hemorrhage and shock. For example, when we observe the difference between dengue fever and yellow fever, they are both characterized by flu-like features with fever, backache, headache, arthralgias, myalgias, fatigue, severe fatigue, severe tiredness, severe weakness of the body, and nausea. These are common features, for example, between most of these hemorrhagic fevers, especially between, they are overlapping features between dengue and yellow fever. هي حمى الدنج وحمى او ساعات بيسموها الدنك، بس هي الدنج فيفر او البريك بون ديزيز او حمى تكسير العظام زي ما بنسميها، هي الدنج فيفر. وبين اليلو فيفر او الحمى الصفراء، common features between both is the pains, especially the headache والباكيك، الصداع والام الظهر، الام العظام، الام المفاصل، الام العضلات، muscle pains, bone pains, joint pains, backache, headache, nausea, and severe fatigue or severe weakness and severe prostration. These are common features. In addition to bleeding, also common in yellow fever and in dengue fever due to damage to the blood vessels. It's a vascular bleeding. وبالتالي بنلاقي skin rash in patients with dengue and in patients also suffering from yellow fever, and also in patients with Ebola and Lassa fever and Marburg disease. So rash develop due to bleeding into the skin, and the bleeding here is vascular in origin. مش يعني it is what we call vasculitis أو a form of vascular damage. مش platelet, مش coagulation defect, مش platelet deficiency. They are other causes of bleeding. So this is a skin rash due to bleeding into the skin, also common in these fevers, which are rare as a prevalence and as an incidence, but the common features of the rare disease is bleeding into the skin due to vascular damage, as I mentioned, in dengue fever and in the yellow fever. But the pains is more severe in dengue than in yellow. In the yellow fever, there is pains, and in both there is pains, but the pains are more frequent, more severe in dengue than in the yellow fever. Bleeding is common in both. In yellow fever, there is additional feature, which is jaundice in the skin. That's yellow color of the skin and the mucous membranes due to liver damage. But there is no jaundice in dengue. That's why in the yellow fever, we call it yellow, because jaundice is a prominent feature in yellow fever. Jaundice. Here I'm talking about what are the differences between, clinical differences between dengue and yellow fever. In the dengue, in both of them, there is pains and there is fever and there is hemorrhages. But the yellow and the what we call the jaundice, it's called yellow fever because there is jaundice. Jaundice is yellowish discoloration of the skin and the mucous membranes, and it's a clinical manifestation, as we all know. And here the cause of the jaundice is hepatocellular in the yellow fever. It's not hemolytic, not obstructive, cholestatic. It is hepatocellular, because we all know that jaundice is either one of three types, either hepatocellular or hemolytic or obstructive or mixture between these in some diseases. In yellow fever, it is hepatocellular due to the liver damage, because then the yellow fever, in addition to the bleeding, the patient develops jaundice due to liver damage, and also there is, in severe cases, in what we call the toxic phase, because in 15% of patients with yellow fever, they develop the toxic phase, which is severe illness with damage to the liver, causing increasing progressive jaundice, and damage to the kidneys, causing renal failure. So the patient might develop liver failure and then kidney failure and shock. And the patient passes into delirium and then coma with shock due to liver damage and kidney damage in patients with severe or toxic phase of the yellow fever. And this happens in 15% of patients with yellow fever, because many cases of yellow fever, it might be regressive and then it recover within few to several days or few weeks. But in 15%, the disease takes a more toxic form or more severe form with high mortality rate in 30 to 60% of patients with toxic disease, that is severe form of yellow fever, due to the liver damage and kidney damage and bleeding, and the patient passes into a state of shock, which is a mixture of hemorrhagic shock and toxic shock or septic shock. And there is high mortality in 30 to 60% of the 15% with toxic phase of yellow fever. So here the yellow fever is dreadful or is fatal in, as I mentioned, in 30 to 60% of those who pass into what we call toxic phase of yellow fever. الحمى الصفراء في بعض الأحيان بتبقى قاتلة زي ما قلت، نتيجة لدخول العيان في الشوك، نتيجة للبليدنج، ونتيجة as a result of bleeding and as a result of damage, viral damage to the kidneys and to the liver of the patient. وبالتالي بيدخل المريض في hepatocellular failure and progressive jaundice وacute hepatic failure, and also kidney damage with acute renal failure, and the patient passes into a state of coma and shock and mortality, that is death later on. And this is the difference between the yellow fever and the dengue. Dengue fever, although there is bleeding also and there is other features similar to yellow fever, but it recovers in most of the cases, and only few cases if the viral load is high and the immunity of the patient is low, like in malnourished patients, for example. And this happened in many cases, especially in Central Africa. We all know as there is poor sanitary conditions and also poor living habits and malnutrition and these things. If the virus affects such cases, they might pass into a state of severe illness with high morbidity and mortality if not treated properly. And here, as we all know, the treatment of yellow fever and dengue fever, there is no specific treatment, there is no specific antiviral therapy, and most of the treatment is supportive treatment with management of or suppression of fever by analgesics and antibiotics, but avoid aspirin and the doctor should avoid aspirin and non-steroidals because they increase bleeding in such cases. Beware when you give analgesics and antibiotics, don't give aspirin or non-steroidal to patient with viral hemorrhagic fever because they increase the incidence of bleeding. And if you want to lower fever and decrease pains, give acetaminophen only, Tylenol. Only acetaminophen. Don't use aspirin or non-steroidals in feverish or febrile cases with dengue or other viral hemorrhagic fevers, or, including the dengue and yellow fever and the Ebola, and because they increase bleeding risk. Be careful. And we only give, the only antipyretic which we give is acetaminophen or paracetamol. There is no, and also we should manage the shock, and we should manage supportive treatment of shock, and by proper hemodynamic resuscitation and proper intravenous fluid resuscitation, as we all know, and until the patient recover, in order to decrease morbidity and mortality in such cases. By the way, these viral hemorrhagic fevers, they are transmitted by mosquitoes to humans. You all know that dengue and yellow fever transmitted by the Aedes aegypti mosquito. and other types of mosquitoes which are breeding in the tropical Africa and subtropical Africa. So they are transmitted by mosquitoes to humans. That is, prevention in such cases is very important. And among the preventive measures is control of mosquitoes which transmit the disease to humans and between humans, the bite of mosquitoes, especially the species of mosquitoes which transmit, like the Aedes aegypti. This is different from Anopheles, which transmits malaria, for example. So mosquito control, and also by vaccines. There is a yellow fever vaccine. So the use of vaccines is useful to prevent such fevers, especially in people working and living in such tropical and subtropical countries in Africa. So vaccines and mosquito control are very important preventive measures, because prevention is more important than cure in such viral hemorrhagic fevers. Thank you so much. This is just a clinical reminder about viral hemorrhagic fevers, which is rare fevers, but dangerous and carry high morbidity and mortality in tropical and subtropical areas. Differential diagnosis of viral hemorrhagic fevers. Clinical reminder to clinicians. Thank you, Professor Dr. Tarek Ali.